Welcome to NC Spin Perspectives, thoughts from opinion leaders in North Carolina. Talking with Dr. Conrad Flick, who is a family physician in private practice in North Carolina. One of the obvious trends we see in healthcare today is hospitals buying up other hospitals, presumably to offer better services and better pricing and so forth like that. Many studies have indicated that what ends up happening is that we eliminate competition and that these merged hospitals actually have higher charges than community hospitals. Why is this merger mania going on today?
Well, I think the market drives things, and the idea that if you look in a healthcare system, you have to have a certain number of patients in order to fill certain criteria. If you're a cardiologist, you need more population than I need as a family physician. I can survive taking care of a population of 2,000, 2,500, but a cardiologist probably needs a lot more than that to get enough cardiology work, and a hospital needs a much greater population than that. So some of this is trying to make sure you have got enough population to fill your beds, to fill your services. They look at that, and so the buying of other hospitals or the buying of practices, particularly primary care practices, is a way to garner that population and feed them into your system. But you're right, it doesn't hold costs down, it drives costs down.
Well, and there was a recent study in Charlotte that showed Charlotte had, what was it, the 5th or 6th highest medical care cost in the entire United States, and cited as a reason for that there were only 2 hospital systems in the whole Charlotte region, and even though they were not for profit, they're among the most profitable in the nation. Is that what's going on? Are these community hospitals just not profitable? Are they not making their own way?
Well, I think community hospitals is a struggling business for the same reason. If you look at rural communities, high Medicaid populations, high Medicare populations, and high unemployment. And so those don't have the benefit of urban areas of having a high insured population to really pay the bill, so to speak. We know that if you look on average as a private doc in an independent practice, Medicare and Medicaid don't cover my costs. And that's true for hospitals as well.
Well, along these same lines, Conrad, what's going on is that these hospitals are also buying up, and by the way, I'm not trying to just jab at hospitals, but the hospitals are buying up lots of doctor practices around them. I'm seeing and hearing where a year or two later, a lot of the doctors are leaving these practices because they don't like all the regimentation and red tape, and actually are not making any more money, or maybe even less money than what they were making before. Why is that trend the way it is?
Well,
as a family practitioner, why would that be appealing to you?
I think there are a lot of things that they teach us in medical school to take care of patients in our residencies. They don't really teach us about business. And there's probably not a more complex business than running a medical practice. You can try to figure out how to do it. You can work your way through and struggle. But I think as time goes on and more regulation comes in, that makes it harder. And so docs sometimes are tired of dealing with the regulation and just want to go back to seeing patients. They sell themselves to a hospital and they just get a whole new set of regulations. And so then many of them do decide.
Sometimes the devil you don't know is worse than the one you do know.
So I think some of them decide over a period of time that it's better to be my own boss and deal with all this difficulty than let somebody else deal with all this difficulty and have a boss that I don't really like.
I have to ask you, as a family practitioner, family physician, what do you think has been the impact on your practice of the Affordable Care Act?
Well, I think there's some good things and there's some bad things. I think the intent is good. Better coverage and better quality, more efficient care is always a good thing. I mean, as I said earlier, as a physician, I believe healthcare ought to be a right in this country. How we do that is up to discussion. Many other countries have done it very well. But the impact for me is a little bit more regulation. I think a lot of companies and others who have taken what is in the Affordable Care Act and misrepresented it, so it makes it look harder than it is, and scare people with it, as opposed to looking at all the potential good for it. It's become political fodder, which, again, I would rather look at the health of our country as not something we could do bipartisan as opposed to being divisive.
Thank you for watching NC Spin Perspectives. We'll have more perspectives all during the week on ncspin.com.